We start with the latest round on strikes. Nurses not backing down.
Yeah, exactly. And it seems that the government will appear to be being a bit intransigent about it. They're not prepared to talk about pay. But then, on the other hand, I think it's well recognised that, we haven't got 19% pay rise to give nurses.
No.
The country is broke. So it needs, it seems to be there's a deadlock and they need to get back round the table and talk and perhaps offer a 7.5%, maybe with an increase for next year. Otherwise, it will just carry on.
Well, this is interesting. This broke actually just half an hour ago. I'm just seeing it now. And it is that talks between the Health Secretary and unions ended without a pay offer being made. Now, that bit we knew, but what we didn't know, and this is new, is apparently the Scottish Government is saying that it's going to impose its offer of a 7.5% average pay rise on nurses. That's north of the border. Potentially something that could happen down here?
Potentially. I mean, I think there'll be a fight whatever way you cut it. And I think what's happened is that perhaps, the nurses have pivoted the narrative rather, as well as all the unions have, to now talk about not just pay, but to talk about the NHS in general. And so they're saying that, this is about patient care. This is about the fact we can't care for, can't look after people safely. And that is winning over public support. And even if the strikes do die down and they come to some settlement, where does that leave the NHS? And that narrative will still continue.